right, we've got time for one more question.
Let me state an observation that I'm confused about, because I'm not very familiar with this. But I hear in this conversation what appears to be terminology that seems to contradict. I hear the term behavior health, and I hear the term mental health. And they would seem to be antithesis to integrated care, because they don't seem to project the same core values and shared understanding that would support alignment and integration. Am I mishearing something?
Anybody want a piece of that?
I'll take it. I absolutely agree with you. Language matters. Language matters.
Yes.
And how things are framed matters for a whole complex variety of reasons. So on the, I'm a psychiatrist, I come from the mental health side. Right? When we say behavioral health, for us it's also code for, in addition to a mental health condition, it is the expectation, not the exception, that there is also a substance use condition. There might not be, but for me, behavioral health incorporates mental health conditions, developmental disabilities, and substance use disorders, which hasn't really been part of the panel today, but that's another big issue. So when I say behavioral health, I'm thinking all the stuff that we do on the psychiatry side, plus the substance abuse related treatment providers who are also behavioral health clinicians. So on the primary care side, that's kind of different terminology. Dr. Ryan mentioned the kind of the cultural divide between the mental health system and the medical world, and how we haven't gotten into a lot of detail, but ways to try to bridge it. And this is one of those things, and I appreciate you pointing it out, that we use different language, and that's one of the issues.
Well, can I tell a story about that? So I was in Santa Fe one day. I was at a conference. It was the National Society of Mental Health Administrators or something like that. And I was one of 5 primary care docs trying to convince these people that integrated healthcare was a good idea. So we all trooped up there. We each had about 5 minutes, told a couple stories. Then a consumer got up. First thing he said is, I've been listening to these people for half hour, and I have one question. What about recovery? And the primary care docs on stage, I kid you not, we looked at each other, we said, what's recovery? True story, true story. This was 7 or 8 years ago, yeah. And we were there pitching this. What about recovery? I kid you not, we all looked at one another and said, what's recovery?
There's so many different examples of how there are language differences. My treatment plan in Dr. Ryan's shop, in my mental health shop, is called an individual plan of service, an IPOS, right? So it's the same thing. It's just a different language, and that's part of the gap that we have to bridge.
Yeah, and that's going to keep that divide.
Yeah,
Yeah.
it does.
This has been a fabulous panel, and thank you so much, Lynn, for
Thank
the
you for having
moderation
me.
and the questions.